Hello friends, welcome to the channel Nursing Brains. Please subscribe to our channel and click on the bell icon for the notifications and the latest updates. Here I am going to give a brief introduction about the channel. This is created to transfer the knowledge in terms of overall development and success of nursing personnel, mainly exam oriented. With a vast experience of 10 years in teaching and 5 years of corporate experience in US based medical technologies, I decided to spread our profession through this channel. Let us start with the basic nursing trends. I hope everyone had seen the thumbnail as the lady with the lamp. We all were well aware that who is the lady with the lamp. The lady with the lamp is Florence Nightingale. So Florence Nightingale is also considered as the founder of modern nursing. So who is the founder of modern nursing? Florence Nightingale. Before accepting this statement, there is a need to know certain things. What are they? They are: who is Florence Nightingale? Why did she chosen this profession? Why she is considered as the lady with the lamp? So what made people to call her as the lady with the lamp? Why did she become the founder of modern nursing? What is the reason behind for making her as the founder of modern nursing? So coming to the point, who is Florence Nightingale? Florence Nightingale is a social reformer, a statistician, a nursing superintendent, and also a trainer. So Florence Nightingale, she actually studied history, philosophy and mathematics. She doesn't belong to science background anywhere. She is a very excellent mathematician and she had a great knowledge in that particular subject. But she always believed that she was called by God and thus she decided to take care of the people who is in needy and chosen the profession nursing. So Florence Nightingale decided herself to submit to the care of the people. So let us discuss and know about her in detail. So Florence Nightingale, she became as a founder of modern nursing and also the lady with the lamp. She was actually born on 12th May 1820 to a wealthy British family. Florence Nightingale was the second one of the two daughters to William Edward and Frances Nightingale. As I said, on God's call, she submitted herself to the care of others. So, she started her medical training of 4 months, which she received in Kaiserwerth Institution of Germany. She became nursing superintendent to the Institute of Care, London on 22nd August 1853. So, after receiving her 4 months of medical training in Kaiserwerth, Germany, she became nursing superintendent in 1853. So, Nightingale, born on May 12, 1820, submitted herself to the care of others. After training, she is appointed as nursing superintendent to the Institute of Care, London on 22nd August 1853. So, why Nightingale is considered as the lady with the lamp? During 1854 to 1856 Crimean War, there was a huge lack of nurses. So, there were no nurses to take care of the people or to take care of the patients or the soldiers who were affected in the war. So, Nightingale, along with her 38 voluntary nurses, they were sent to Turkey to serve the soldiers. Nightingale, during her period of working there in the Scutari Hospital, that is the military hospital of Turkey, she used to go for rounds even during the night times to take care of the soldiers. So during that olden days, in the dark nights, she has been carrying a lantern and going for rounds to the patients. Thus, she is called as the lady with the lamp. This thing was published in Times of London as ministering angel making rounds with a small lantern. So Times of London recognized the services of Florence Nightingale, mentioning her as an angel making rounds with a small lantern, and thus Nightingale is considered as the lady with the lamp. Then after this, why did she became the founder of modern nursing, and how did she became the founder of modern nursing? That is, Nightingale during Crimean War provided her services at military hospital in Scutari, Turkey. Many soldiers died there because of lack of sanitation, hygienic food, and medicines. The Nightingale submitted a detailed report to the government of England about the diseases. If we see many of the pictures, if we go to Google and if we search somewhere, we find many of the pictures regarding Nightingale, soldiers, and the setup of the hospital there. The report detailedly stated that the soldiers died because of lack of food, lack of medications, lack of drainage facility, lack of dressings to the wounds even. They suffered a lot with the open wounds, and the hospital is full of insects and rats. So because of these unhygienic conditions, many people, that is many soldiers, died in that military hospital. So Nightingale submitted a statistical report regarding these diseases such as tuberculosis, plague, etc. When these soldiers died, the report was submitted to the British government stating the situation of the hospital. So because of this, she was considered as the founder of modern nursing. So thus Nightingale had become the founder of modern nursing. After Crimean War, Nightingale developed a theory known as environmental theory. So this theory states that a person or a patient can recover from his diseases by utilizing his environmental status. So during Crimean War, after observing those situations, she believed strongly that the disease can be cured by the external environment. So soldiers were dead not because of the wounds but because of the sanitary conditions, that is the unhygienic conditions. So her environmental theory states that 5 environmental factors assist in recovery. Those are fresh air, pure water, effective drainage, cleanliness, and direct sunlight. Even every one of us are aware of this, right? Yes, of course, fresh air, pure water, cleanliness, everything makes a person to be healthy. So environmental theory is the best theory proposed by Nightingale during those days after the Crimean War. This is about environmental theory. Because of all these things, Nightingale is considered as the founder of modern nursing. So we as nurses, we should be proud of Nightingale and we should definitely accept this statement. Then, after returning from Crimean War, Nightingale was honored by Queen Victoria with a valuable necklace that she used for establishing the School of Nursing, that is, the Nightingale School of Nurses, which is established in 1860 by Nightingale at St. Thomas Hospital. She had trained many nursing students during that period. She also received other awards such as Royal Red Cross Award, Lady of Grace, Order of St. John, and Order of Merit. Also, another great honor was given to Nightingale, that is, The Nightingale's birthday is celebrated as International Nurses Day, which is a great honor that her birthday is considered as Nurses Day, that is May 12th every year. So, even many nursing colleges and schools will celebrate lamp lighting ceremony for the freshers on that particular day. So, Nightingale is to be honored on the basis of all the services provided by her. So, Nightingale is definitely a pioneer of modern nursing. After rendering many services, at last Nightingale died on 13th August 1910. She died because of lack of sleep and rest and tiredness. Thus, she passed away on 13th August 1910. So, Nightingale's birthday is celebrated as International Nurses Day. She died on August 13th, 1910, and thus Nightingale is considered as the lady with the lamp and also the founder of modern nursing. So, let us go through some important questions. Those are examination based. We have 2 slides with the 10 questions which are very important. Please go through the questions. Do not skip the video. So, first question. Who is the founder of modern nursing? The founder of modern nursing is Florence Nightingale. The founder of modern nursing is Florence Nightingale. International Nurses Day, that is May 12th. International Nurses Day is celebrated on May 12th. Florence Nightingale was born on May 12th, 1820. Florence Nightingale was born on May 12th, 1820. Florence Nightingale is also popularly known as the Lady with the Lamp. Florence Nightingale is also popularly known as the Lady with the Lamp. What is the theory laid by Florence Nightingale? The theory laid by Florence Nightingale is environmental theory. The theory laid by Florence Nightingale is environmental theory. So, the founder of modern nursing is Florence Nightingale. International Nurses Day is celebrated on May 12th, and Florence Nightingale was born on May 12, 1820. Florence Nightingale is also popularly known as the Lady with the Lamp, and the theory laid by Florence Nightingale is the environmental theory. Each and every question here is very important. If we go back and check previous examination question papers, we can find at least 1 or 2 questions from these topics. So please do not skip this video until the 10 questions, and next we are going to discuss further 5 questions which are also very important for the examination. So I hope you people had understand the questions till now and the answers. So coming to the next questions, those were 5 questions. Those were also very important questions, and in all the examinations we can see these questions asking frequently. During which war Nightingale had rendered her services? That is Crimean War. During which war Nightingale had rendered her services? That is Crimean War. What was the name of the nursing institution Nightingale had started? Nightingale School of Nursing in 1860. So, Nightingale has started the institution, that is Nightingale School of Nursing in 1860 at St. Thomas Hospital. Florence Nightingale died on August 13th, 1910. Florence Nightingale died on August 13th, 1910. Who is the pioneer of modern nursing? So the pioneer of modern nursing is Florence Nightingale. So the pioneer of modern nursing is Florence Nightingale. Which theory states utilization of patient environment? So the theory, environmental theory, states the utilization of patient's environment. So Nightingale rendered her services during Crimean War. She established Nightingale School of Nursing in 1860. Florence Nightingale died on August 13th, 1910, and she is the pioneer of modern nursing, and she developed a theory, that is the environmental theory, which states the utilization of patient's environment for recovery. I hope everyone is clear about Florence Nightingale. So Florence Nightingale topic is very important, and I hope our thumbnail is justified. So thanks for watching.